Hi everyone, today's video is going to be on Bell's palsy. What is Bell's palsy? Bell's palsy is a type of peripheral nerve palsy which involves cranial nerve number 7, which is the facial nerve. Now, this is what a patient with Bell's palsy is going to look like. Now, if you look at this picture and you suspect that there is an abnormality on one side, you would think that it's probably the left side of the patient. But it actually is the right side of the patient which is affected. Now, what are the etiology of Bell's palsy? Well, you see, the cause of Bell's palsy is not exactly known. HSV reactivation has been implicated. Okay, the herpes simplex virus, we know one variant of it. It establishes latency within cranial nerve number 5, which is the trigeminal nerve. So it may have a role, the herpes simplex virus reactivation may have a role in causing Bell's palsy. There are other causes as well, such as Lyme disease, sarcoidosis, etc. Right? Now, what is the pathophysiology of Bell's palsy? Again, just like etiology, it's not exactly clear, but there is a theory that suggests that it's related to edema and ischemic damage of the facial nerve itself. You see, this is a complicated diagram. It looks like a complicated diagram. But the point that I'm trying to make here is that the cranial nerve number 7, which is the facial nerve, it passes through internal auditory meatus within the temporal bone. It then passes through the bones, leaves the bone through a stylomastoid foramen. Throughout its course, as it courses through all of these bones, it passes through a canal called as the facial nerve canal. It's thought that this edema and this ischemic damage, which occurs to the facial nerve, might happen actually in this canal which transmits the facial nerve. Okay? Now, what is actually important to understand is that there is a damage to cranial nerve number 7. That is the most important thing to understand with regards to the clinical features. You see, before understanding what are the clinical features, we have to understand the normal function of cranial nerve number 7. You see, the facial nerve has motor function. Okay, it has parasympathetic function, it has sensory function. So first we can talk about the motor function. So what is the motor function? You see, there is a motor nuclei for the facial nerve which is present in pons, and this is responsible for supplying all of the muscles of the facial expression. You see, it's the major nerve which is responsible for the motor function of the face. Okay, and the main muscle and the main nerve which is responsible for the muscles of facial expression. Another muscle that it supplies is the stapedius muscle. What is the stapedius muscle? Well, the stapedius muscle is present in your ear. In your ear, you have a bunch of ossicles, and these ossicles are going to vibrate back and forth in order to transmit the sound waves to, essentially to the oval window. Okay, and one of the ossicle is the stapes, right? Are the stapes, right? Now, this is one of the ossicles that vibrates back and forth. The idea is that as the ossicles vibrate back and forth, the more they vibrate, that will increase the volume of the sound, that will increase the intensity of the sound. And the lesser they vibrate, that will result in dampening of the sound. So you won't hear loud sounds because of that. The stapedius muscle is a regulatory muscle that dampens, it controls these stapes and it dampens the vibration of the stapes, thereby preventing loud sounds in your ear. Okay, so that is the motor function of the facial nerve. Now, what about the parasympathetic function? You see, one of the facial nuclei is known as the superior salivatory nucleus. This is a parasympathetic nucleus, and it gives rise to preganglionic parasympathetic fibers that go to two different ganglion. Okay, one of them is the pterygopalatine ganglion, and the other one is the submandibular ganglion. The pterygopalatine ganglion is going to send postganglionic fibers to the lacrimal glands. Okay, and the submandibular ganglion is going to send postganglionic fibers to the submandibular and the sublingual glands. Okay, so all of these are from this superior salivatory nucleus. Okay, now what is this responsible for? When it goes to the lacrimal glands, it's responsible for lacrimation, for tears. Okay, when it goes to the submandibular and the sublingual gland, it is responsible for salivation. So these are the parasympathetic fibers to the submandibular, sublingual glands, and also to the lacrimal glands. Now, what about the sensory function? You see, you have a tongue. We all have a tongue, I hope. And the tongue, well, one of the sensations that is carried from the tongue is taste. And the taste from the anterior two-thirds of the tongue is carried by the facial nerve. The taste sensation from the anterior two-thirds of the tongue. Okay, so these are the normal these are the normal functions which are played by the facial nerve. Now, if there is an injury or there is a palsy to the cranial nerve number 7, you would suspect these functions at least are to some extent affected and to an extreme extent lost. So, this is what you see in Bell's palsy. The clinical features in Bell's palsy is motor loss. So we talked about forced motor function, which is responsible for, supplying the muscles of facial expression. So here you're going to see ipsilateral paralysis of the face with drooping of the mouth corners on the affected side. Okay, because again, the muscles for facial expression are paralyzed, so this is what you see. The second thing is hyperacusis. Hyper means too much, really, and acusis means sound. So it's just loud sounds. Why? Because there's paralysis of the superior muscle. Because the cranial nerve number 7, the facial nerve which was supplying the superior muscle, can no longer dampen sounds, and now the patient starts to experience or hear loud sounds. Then there are parasympathetic loss. Well, as we said, the parasympathetic fibers are responsible for lacrimation, salivation, so therefore you see in patients that there is partial loss of salivation and partial loss of lacrimation. Also, there's sensory loss, again, loss of taste sensation from the anterior two-thirds of the tongue. So these are the clinical features that you can see in a patient with Bell's palsy, apart from just the paralysis of the face. Okay? Now, we can talk about recovery and treatment. Well, there is good news. And the good news is that, well, the patients with Bell's palsy will gradually regain function. And that's for most people who have Bell's palsy. However, in some patients, there might be some abnormal regeneration that can occur. The treatment for it is usually corticosteroids with or without acyclovir, which is an antiviral drug. And that's about it. Thank you very much for watching my video, and I hope you enjoyed.